Welcome back to Your Health Matters. I'm Jamie Taylor, and my guest today is Dr. Wilson Otero. We're talking about your colon health. And thanks for being on the show again, Dr. Wilson, or Dr. Otero.
It's a pleasure to be here.
Thank you so much. We were talking just before the break about nutrition and how important that is to your colon health, and that the nutritionists that we have here, the registered dietitians, you refer to them frequently?
I refer to them on a daily basis.
Okay.
I think they're part of the backbone of good gastroenterology because diets are so important to our health.
It's basically what goes in, what comes out type of thing, right?
We're having an epidemic nationally of diabetes, hypercholesterolemia, hypertension, arteriosclerotic heart disease, and we need to control it. And we know that if you can correct the diet, you can certainly have an impact on heart disease, hypertension, diabetes, and we need to give people more instruction.
So really, and the majority of those issues, those health issues, come from our diet, right?
A lot, yeah, the majority come from our diets. We actually have a name for it called the metabolic syndrome, where there's a constellation of things that we find in people. It has to do with accumulation of fat around the belly, tendency toward diabetes, high cholesterol, tendency toward hypertension. These are the major things you find, and if we can correct the weight, if we can help correct the cholesterol, if we can lose weight and control the sugar, we can have an impact on long-range health.
That's great. I mean, it's actually one of the easier things, better than taking a pill if you don't have to, right?
Well, you know, it's interesting because a number of people lose 20, 30 pounds, and they no longer have hypertension, and they no longer have diabetes, and the cholesterol becomes normal without taking any pills.
Yep, that happened for me. I lost 40 pounds in the last year, and I'm off all my diabetes medications, blood pressure, all of that. It's wonderful.
And this is the way for our population to go.
Yep.
If we can do it in a constant fashion rather than binge dieting, if we can change our dietary habits and we can increase our exercise, I think that it will have a tremendous impact on the general health.
Yeah, it's a lifestyle change. I know it is for me. And once I kind of changed my thinking about what I was eating and why I was eating and when I was eating type of thing, I was amazed how much food I used to eat. It's amazing. I look back and I go, oh, it's kind of embarrassing, but I get by on a whole lot less.
You know, we're all guilty of it.
No.
You're all guilty, and we all have to try to work at it together.
Okay, yep.
I wanted to make a point there that when I say we're all guilty, well, here at Kingman, I think our approach to these problems is a good one. I don't work by myself. I work with a group of people, and frequently I'll see people in the office who come in for a GI complaint, but they don't have a GI problem. Sometimes people can have epigastric pain or discomfort, and it may not be coming from the stomach or the esophagus. It can be the heart.
A heart can give you indigestion type of thing?
The heart can give you symptoms that can mimic indigestion. Sometimes even lung problems can disguise themselves as a little bit of reflux or chest discomfort. So that one of the advantages is that in our hospital we can easily refer to other subspecialists. I find myself sending people to the cardiologist, sending people to the pulmonary man, having other specialists give me their opinion. And I think it improves quality of care.
Absolutely. I know I'm very proud of what I call our family of healthcare providers that we have here at KRMC.
I think you're right. I think it's a very good group. And the idea is to work as a group to try to continue to give good care.
Okay, yeah, I agree. Now, if someone has some symptoms that they think they need some help with, then they could call your office to come in and maybe get some questions answered. Okay.
I have two MAs in the office, Jennifer and Beverly, and they're very friendly people from our community who've been here many years, and they will answer questions on the telephone.
Okay.
And if they call, if we can help you, we can refer you to someone who can.
Okay. And what is your office number before I forget?
The number is, let me see if I remember, 928-681-8800. 8715.
8715. So 681-8715. Okay.
If they call and they need help, we will help them.
Okay, good. And I know that we also have information on the hospital website, the www.azkrmc.com. They can go there and find a physician and look up your page, and it's got a beautiful picture of that smiling face and gives all of your medical background, your education, and your office phone number and location. So.
There's something else to emphasize, I think, and it's that we have the infrastructure, we have the radiologist, we have the diagnostic capabilities here to provide people with top-notch gastroenterology. We can do the latest CAT scans, the latest x-rays. We have a number of radiologists that are top-notch, Mayo-trained radiologists who are very cooperative, and we work hand in hand to try to provide good service. Independently, we have a cancer center for those unfortunate people who have a more serious diagnosis, where we can treat them in a timely, modern fashion and either resolve their problem or improve their quality of life.
Right, right.
So we do have many, many resources here in our community.
I know, it's amazing. I think a lot of times people kind of make the assumption that because we're a small rural community that they have to go outside of Kingman to get that quality of care. And that's not the case, because we have that right here.
We are in the desert, but we are not of the desert.
That's right. I like that. That's
we are not desert people. We're modern, well-educated, medically aggressive physicians, and if we can help you, we will refer you.
Right.
And if you have to go to the Mayo Clinic, so be it. But we try to do the best possible job here in our own community.
And that's another thing I share with people all the time, the advantage to being able to have that care here at home versus having to go and stay in a hotel room and the expense of traveling, especially nowadays with the price of gas and not having your family around you. You know, it's just...
Well, I'll give you a testimonial. About 3 months ago, I had an upper GI bleed. And I chose to stay here in Kingman. My GI bleed was controlled. I was very, very well managed. And I was quite happy, and I'm here sitting alive and healthy.
Very good. We're glad about that.
What can I say? I'm not only a provider, I'm a consumer.
There you go. Well, and that says a lot right there, too, that a physician thinks enough about Kingman Regional Medical Center to get his own health care here. Right?
I'm alive and well.
Yeah, that's a good thing. That's a very good thing. Now, we talked earlier again about GERD, and you mentioned Crohn's disease, and I know a number of people myself who have Crohn's disease, and I don't know how much the community is aware of that or some of the other gastro issues. Maybe should we talk a little bit more about those?
I think it's a very good idea.
Okay.
That everything that happens in GI is not simply an ulcer or colon cancer.
Right.
The 99% has nothing to do with these problems. We have infections that have to be detected, H. pylori in the stomach, for instance. We have food poisoning. We have poisoning from water. We have medications that can affect the liver. We haven't mentioned liver disease.
No, we haven't.
We have a large number of residents that have hepatitis C, people that have chronic hepatitis B. We have many people with alcohol-related liver problems. We're handling all of those here.
So that all falls under gastroenterology?
That is all under gastroenterology.
I did not know that.
We have people that have simple things like hemorrhoids. That's gastroenterology.
Right, okay.
Hiatal hernia, reflux, gastroenterology. But the Crohn's disease in particular is very interesting to me because we have a significant number of people that have it. And there is a Crohn's Ileitis Foundation that I like to refer patients to, so that I not only see them, but I try to get them to educate themselves.
That's a good thing. Is there like a support group?
They have support groups, they have newsletters, they have the latest information.
Good.
And we try to stay abreast of the latest. We're actually giving the immune modulation treatment, the Remicade treatment here, and the Humira treatments.
So again, you're able to help them right here at KRMC.
I think we have everything we need to treat the vast majority of cases of inflammatory bowel disease.
Okay.
Related to that, we have very, very good surgeons, that are in backup in case there should be any need for surgery.
Okay.
And these men are experienced in taking care of people with inflammatory bowel disease.
Which is a scary, scary illness, I know, and can be very debilitating.
In most cases, it's not nowadays, and the outcomes seem to be much, much better every year.
Oh, that's good news. That's good news.
Yes.
Remind me and our audience again, your phone number, if they have questions and they'd like to call.
My number is 928-681-8715.
8715. Okay.
No call is insignificant. If you think there's something wrong and we can help you, please call.
And the good thing, like you said, is the fact that if you can't help, you know people who can, because you've got referrals.
That's exactly how it works.
Right, very good. Well, thank you again, Dr. Otero. I really appreciate you being on the show.
I'm happy to be in your community, in our community, and I hope that I can continue to help.
Very good. We'll have you on the show again sometime in the future. Thanks. And thank you all for joining us. We'll see you next week. Have a good time.